Uh, Thank you, sir. Actually, I'm sorry for the small confusion. Dr. Partha had told me to talk on a different topic. My father was supposed to talk about, reversing diseases and food. So, on this onset, I'd like to thank AIOS for giving me this opportunity. So, today's question is, how do I start my private practice, or generally, how do I start my practice? See, now the path to becoming a doctor is pretty simple and clear. Everyone goes through it, and you can reach. And once you've reached the phase where you become a doctor, suddenly the question crops up: what do I do next? And there are a series of questions which come to our head. So always remember, where you start is not as important as where you finish. So all of us start at different starting points, right? Some of us start in a place where you're one of the first doctors in your family and friends, and you have very little money in your pocket. The other scenario where you can start is where you're again one of the first doctors in your family and friends, but you have enough or a lot of money in your pocket. And the next scenario is you already have a nice, good, established few suggestions on where to start your practice, how to build your practice, and also put you across certain contacts with the company so that you get good deals when you're planning to acquire these machines. Now, when you're going for the machines for your private practice, initially it's good to go on a rental basis so that it's very light, and or you can also go for a refurbished machine initially. And as you move forward and you can afford a good new one, then you can go ahead with that. The next thing is refractive practice. You can start from the very beginning itself. You don't need to do any investment. With the phakic IOLs, you can start, if you have a cataract setup, then automatically you can start your refractive setup also. So that what happens from then itself, you're building up your refractive, patients, a group of patients who keep coming to you, so that when you do buy your lasers, then it becomes easy for the transition. So it's not the salary that makes you rich, it's the spending habit that actually makes you rich. Please remember this. So the next starting point is, what if you're in a scenario where you have adequate or enough money in your pocket, but you're one of the first one in your family and friends. So in this scenario, when you're starting your private practice, go all out. Make sure you build a good big hospital, comprehensive. Make sure you have all specialities, have the best machines, and try to minimize referrals. Do not refer patients. Try to somehow slowly, get the skilled doctors to handle all kind of scenarios. So it's very, very important. And when you decide the location, you always do a market survey, and then decide where you want to place your hospital. Always assess your local competitors and see what is their plus points, what their minus points. And other thing is also the price, what everyone is look around and see what everyone is pricing for different procedures, consultation fees. So initially, when you do launch your hospital or start your private practice, you can maybe, as a promotion, you can really do a very competitive price initially, so that there's more footfall, and then slowly you can change accordingly. The next thing is, always have a good relationship with the multi specialty hospitals or physicians who refer. If at all they do refer, always write back to them and also inform them what's happening to the patient. This is a very, very, very important step. Now, what if you're in a scenario where, okay, you already have a good hospital with you, you just have to go in, and the process seems easy. No, actually, it's not. This also is very difficult. And always do not be afraid to give up the good to go for the great. So this is a very more of a fine tuning process. You have to really micromanage. So these are the few steps that you need to look at. You have to come out of the system and look from outside how the hospital is doing first. You need to really assess how the system is working. Get into the patient's shoes, see what the patient likes about your hospital, what the patient does not like about your hospital. And also you need to make make the hospital more efficient. Look at the system and how the flow goes. You have to improve it by, you have to, by one of the ways is to reduce the, reduce the lower margin. You need to be very cost effective. You have to monitor the needless spending or expenditure. The small things make a big difference, like be it a tissue box. Sometimes excessively tissue is being used left, right, and center, or hand sanitizers. You would start from the small and then you go up from IOLs, viscoelastics. Everything should be monitored and see how you can do it. And also look for if somebody is trying to fool you or cheat the system, and try to close these loopholes is very, very important. Now try to assess the individual performance of all the different doctors and the staff, and try to see how you can improve their skills. See, we keep as a training institute, we keep training our fellows and students. Then suddenly we're like, actually we just realized we're not trained our consultants. They only don't know these techniques. The fellows and students are knowing this technique and going out. So please do not forget your own staff, and then create certain standards and parameters so that the outcome of the treatment and the outcome of the patients is the same throughout the hospital. The next thing is training the paramedical staff is very, very crucial. Educating the counselors is so important. They should really know what procedure, what is done in the procedure, what each IOL does, how is it different from each other. See, it's very important. Simply, okay, just counsel the patient, convince them for a package. It shouldn't be like that. They have to really know why is it more better, why the higher package is more better. So it's very important this, and also write some kind of a script so that it's the same lines that they keep talking to the patient, so that the standard is maintained throughout the counseling.
Can you wrap up, please?
Yes, sir. The next thing is strategizing is very important. When see, now once you have optimized your own system, then what you can think about is expanding. So when you're trying to expand, again, you have to do a market survey, look for places where it would strategically work really well. And also, if you're planning to buy a land and then build one more branch, you think about whether it's better to buy it outright, or is it better to take it on a lease and pay rent. Because you need to do a simple calculation. Let's say if the land cost is about 3 crores, is it good or good to buy it out? Or let's say if I put this same money in a bank with the 8% interest, does it work out? So you have to do this calculation and see whether the leasing is better or not. The
Can you
next thing
sum it up?
is,
Can you sum it up, please? Time is
yeah, this is
over.
my last slide, sir. So the next thing is just to have an edge over the different other hospitals. You can please get into research. That way, all the staff is already, they keep updating themselves in terms of knowledge and skills, and try to incorporate research which you translate to your clinics too, so that you give back to the society in terms of better techniques, better surgery, and better machines. What is common in all categories, or all of us should do, is we need to be humble. We need to really connect with the people. Make sure that you genuinely care for your patients, because patients know what you genuinely are feeling inside. Always encourage the patients to give their feedback. Have a healthy relationship with your competitors. Please do not bring any doctor down, not just any doctor, any person down in your life. Always encourage everyone, be positive, because at the end of the day, we have to remind ourselves, why are we here? We are here to help our patients and bring a smile on them.